In this last video, we are going to talk about labor and what happens after that baby is born. The process of labor is also called parturition, and it's going to be triggered by a decrease in progesterone and an increase in prostaglandins. Prostaglandins are also going to be important for those changes that I mentioned that are happening in the cardiovascular system. And those two are going to do a positive feedback with oxytocin. All of them are going to be important for the laboring process because, for example, the prostaglandins are going to be initiating or starting that labor. And then oxytocin is the one that is going to be important in contraction of the uterus, because if the baby is going to come out, that uterus needs to contract, and that what those contractions during labor are. Then we also need to stretch the cervix, right? Because the fetus is coming from the uterus down into the vagina, and that means that it needs to go through the cervix. And when that happens, when that head is close to the cervix, then there's going to be that positive feedback so that you can have stronger uterine contraction and secretion of oxytocin. And actually, Pitocin, the drug that is given for labor, is going to be an agonist of this process. So it's going to make those contractions happen faster. That is also going to allow for the contraction of the abdominal wall, and then to force that fetus through the birth canal. And you can see that right here. Here you have the fetus inside the amniotic sac with the placenta and the umbilical cord. Here is the cervix. When females are told how dilated they are, is how open that cervix is, which is going to allow for that baby to then come out, right? Once that happens, the amniotic fluid breaks. That's when somebody's water breaks. That's what's breaking. It's the amniotic sac. So the fluid comes out. And then that way that fetus can come out. And then after, it's going to come out attached to the umbilical cord. That's when the umbilical cord is cut. And then later you have the expulsion of the placenta that comes out with the rest of the umbilical cord. So as you can see, it's a positive feedback where the fetal head touches the cervix is stretched, those stretch receptors are stimulated, and that is going to make contractions even stronger. So the fetus moves downwards again, and it's going to keep happening again and again with secretion of oxytocin to contract that uterus so that it can push that baby out. Then once that baby's out, there's going to be the start of milk production on the woman's breast. That milk production is going to happen because when progesterones and estrogen are going to be during that pregnancy, right? They are going to develop. They're going to help develop the mammary glands, and prolactin is going to be secreted so that that milk can be produced. Once that happens, that first milk that comes out of the woman's breast is going to be called the colostrum. It's very important for babies to take that colostrum because it's rich in proteins and antibodies. And there's not a lot of it, but the amount that comes out is very important. Then after a few days, then woman starts creating milk. Now, before pregnancy, right, there are going to be hormones that are going to be secreted to develop those breasts. So that's why when women are pregnant, their breasts are going to be enlarged. Then this is during puberty. During pregnancy, right, we're going to develop a different kind of tissue in the breasts that is going to be important for the production and for giving milk. That prolactin is going to be secreted, but there's no milk production because there's progesterone in the environment, and progesterone blocks or inhibits the production of the action of prolactin. But once birth happens, then you have a decrease in the concentration of that progesterone that now allows prolactin to do its job, so the breast can produce the milk, and then that milk is going to be secreted by releases of oxytocin. That oxytocin is going to be released, and also prolactin is going to be secreted when there is stimulation of the nipple. As long as that stimulation is going to be there, then you're going to be producing milk. Once that nipple is not stimulated, then that milk is going to be decreased. The production is going to decrease. These are two different types of breast. The left one is a non-milk producing, a non-pregnant breast, and this is the pregnant breast. You can see where you have tissue that is going to be able to secrete milk, and later that milk can come out. This is going to be that tissue, and then when that liquid comes out, it's going to go out different ducts. Those ducts tend to be dilated so that milk can come out. As I mentioned before, it's in a response to the suckling of the infant that oxytocin is it's going to be produced, and it's going to allow the ejection of that milk, in addition to the increase or the maintenance of the production of prolactin, and that is also going to maintain the feeding process. Once that the baby is born, then there's going to be that neonatal period, which is the first few weeks. Then it's going to be an infant, then it's going to be a child, adolescent, adulthood, and then senescence, which is when we are kind of like at the end of our life. As I mentioned, and this slide should probably be somewhere else, but let me just mention it here, that once that baby is born, right, once you have that newborn, there are going to be changes that need to happen in the cardiovascular system so that blood flow can be normal. One of that is going to be the constriction of a bunch of different blood vessels. You're not going to need umbilical veins anymore, so they're going to constrict, and they form what is called the teres ligament. Then that ductus venosus that used to be above the bypassing the liver is going to become the ligamentous venosus. The foraminal valve is going to close, right? And then the ductus arteriosus is going to become a ligament. Imagine a blood vessel that constricts, and it's no longer allowing blood to go through. It's going to be called the ligament, and it's called the ligamentum arteriosum. And those umbilical arteries, they're not going to be there anymore, and because you don't need them anymore. So you're going to close down every single blood vessel that you no longer need. You can see them here. Here's the ligamentous venosus. Here is the ductus arteriosus becoming the ligamentum arteriosus. The foraminal valve closes, and both the veins or the arteries of the umbilical cord are also going to constrict because you don't need them anymore. These are just some of the things that happen during development until we end up at old age. And this is the end of chapter 23.